According to Amy Albright, a good death is an important part of a good life. Welcome to our online lecture on spiritual care in palliative care. What is palliative care? How is it defined? Palliative care is an approach that aims to reduce suffering and to improve the quality of life for people who are living with life-limiting illnesses. Care is focused on relief of pain and other symptoms, as well as on the psychological, social, cultural, spiritual, and emotional needs of each person and their family. By 2026, the number of deaths in Canada is projected to increase to 330,000 people and to 425,000 by 2036. Currently, despite Canadians' wishes to die at home, 60% die in hospitals. Of the over 270,000 Canadians who die each year, 90,000 die of chronic illness such as cancer, heart disease, organ failure, dementia, or frailty. Palliative care is appropriate for persons of all ages with any life-limiting illnesses and at any point in the illness trajectory. In 2018, Canada published through Health Canada a framework for palliative care. I've posted this framework on Blackboard for you. You will see that you can link to it through Unit 7, the Spiritual Care and Palliative Care Unit, and it is the document listed at the bottom there. The framework on palliative care in Canada has looked at Indigenous peoples. Representative of Canada's Indigenous peoples have been clear about the importance of culturally appropriate palliative care for their communities. Health Canada and national Indigenous organizations have started and will continue a discussion about Indigenous-led engagement toward the development of distinctions-based framework on palliative care for Indigenous peoples, reflecting the specific and unique priorities of First Nations, Inuit, and Métis Nation. The framework on palliative care in Canada recognizes human diversity and recognizes that the people in Canada are diverse. Our population consists of many different ethnic backgrounds, languages, cultures, and lifestyles. And while diversity is a natural characteristic of every society, being inclusive is a choice. Just as we Canadians pride ourselves on embracing our diversity and on being inclusive, palliative care recognizes Canada's diversity and encourages the adoption of inclusiveness, paying attention to ensure that people from underserved populations are taken into consideration as we aspire to universal access to palliative care. The framework on palliative care in Canada promotes culturally safe and competent care that reflects cultural knowledge. It also supports the diverse voices of persons with lived experience, family members, and their caregivers. The framework on palliative care in Canada recognizes a number of different principles. One of these is that palliative care should be person and family centered. This refers to an approach to care that places the person receiving care and their family at the center of decision making. The voices of people living with life-limiting illnesses and their families are solicited and respected. Individuals and families have personal preferences and varying levels of comfort in discussing and planning for the dying processes and death itself. The framework also acknowledges that palliative care should be holistic in addressing a person and their family's full range of needs, including their physical needs, their psychosocial needs, spiritual needs, and practical needs, at all stages of illness. The framework also recognizes that palliative care should be equitable, that Canadians with a life-limiting illness should have equitable access to palliative care regardless of the setting of care or personal characteristics, including things like illnesses, age, their status, Canadian Indigenous people status, religion, spirituality, language, legal status with respect to citizenship or incarceration, sex, sexual orientation or gender identity, marital or family status, race, culture, ethnicity, or country of origin, economic or housing status, geographical location, or level of physical, mental, and cognitive ability. The framework also recognizes that palliative care should be flexible. A palliative care approach requires adaptability and humility on the part of the healthcare provider and the health system in order to reach a shared understanding of what the needs of each individual may be. So let's now specifically examine spiritual care in palliative care in Canada. So what should spiritual care include? We know that as patients move towards the end of life stage, the impending confrontation with death may promote a person to engage in spiritual reflection. People begin to ask questions about the meaning of life, what happens after physical death. Spiritual care is regarded as very important, but professionals have had difficulty in defining what kind of care this might include. In a lot of the research literature, we've seen that there is a very distinct division between the concepts of religion and the concepts of spirituality. Religion is more about systems or a social institution that's joined or organized by individuals who share the same beliefs, traditions, and rituals. Religion is characterized in many ways by its boundaries. Spirituality is defined by actually the difficulty to define boundaries. Spirituality may be used by those who wish to move beyond institutional religion. It's more defined as a personal search for meaning and for purpose in life, which may or may not be related to religion itself. In this model, looking at dimensions of spiritual need in the context of spirituality and palliative care, we can see that most definitions of spirituality and research in spiritual care at the end of life focus on relationships. In this model, created by a researcher by the name of Keller, he looks at dividing the concept of spiritual need into three quadrants. The first being situational, people looking to define purpose, hope, finding meaning and affirmation, looking at their connectedness to other people through relationships, and that they have a social presence in the world, that their life meant something. Then he looks at a second quadrant that he calls the moral and biographical quadrant, where people, he believes, look for peace and reconciliation. They look for a reunion with others in their relationships. They seek prayer. They begin a moral and social analysis. They ask for forgiveness. And they look for closure on issues in relationships. The third quadrant that he defines in this model looks at religion, and it looks at specifically religious reconciliation, which could include rites and rituals around reconciliation, looking for forgiveness from God, looking to religious rites and sacraments. This kind of spiritual care may include visits from religious leaders within the community. People may begin to engage in reading religious literature or holy books. They may engage in discussions about God or eternal life and hope in life after physical death. So let's look at an example of this. I'm going to spend a few minutes and tell you the story of Holly Butcher, who was born in 1990 and who passed in 2018. Holly wrote a letter that she asked her family to publish after her death. And in many ways, this was Holly's journey of spirituality to find meaning in relationships and hope, to do that kind of moral and social analysis about what life means. And so she writes this. It's a strange thing to realize and accept your mortality at 26 years of age. It's just one of those things you ignore. The days tick by and you just expect they will keep on coming until the unexpected happens. I always imagined myself growing old, being wrinkled and gray, most likely caused by the beautiful family, lots of kitties I planned on building with the love of my life. I want that so bad it hurts. That's the thing about life. It's fragile, precious, and unpredictable. And each day is a gift, not a given right. I'm 27 now. I don't want to go. I love my life. I am happy. I owe that to my loved ones. But the control is out of my hands. I haven't started this note before I die so that death is feared. I like the fact that we are mostly ignorant to its inevitability. I just want people to stop worrying so much about the small, meaningless stresses in life and try to remember that we all have the same fate. After it all, so you can make your time feel worthy and great, minus the bullshit. So Holly writes down a lot of her thoughts. She's pondered these over the last few months of her life, usually in the middle of the night. And here's some words of advice. Don't sweat the small stuff. Those times you are whinging about the ridiculous things, sometimes I have noticed so much of these in the past few months. Just think about someone who is really facing a problem. Be grateful for your minor issue and get over it. It's okay to acknowledge that something is annoying, but try not to carry on about it and negatively affect other people's days. Breathe. Once you do that, get out there and take a freaking big breath of that fresh air deep into your lungs. Look at how blue the sky is and how green the trees are. It's so beautiful. Think how lucky you are to be able to do just that. Breathe. Enjoy nature. Get up early sometimes and listen to the birds while you watch the beautiful colors the sun makes as it rises. Be grateful. I hear people complaining about how terrible work is or about how hard it is to exercise. Be grateful you are physically able to. Work and exercise may seem like such trivial things until your body doesn't allow you to do either of them. Be ruthless for your own well-being. I tried to live a healthy life. In fact, that was probably my major passion. Appreciate your good health and functioning body, even if it isn't your ideal size. Look after it and embrace how amazing it is. Move it and nourish it with fresh food, and don't obsess over it. Work on all aspects of health and happiness. Remember, there are more aspects to good health than the physical body. Work just as hard on finding your mental, emotional, and spiritual happiness too. That way you might realize just how insignificant and unimportant having this stupidly portrayed perfect social media body really is. While on this topic, delete any account that pops up on your news feed that gives you any sense of feeling awful about yourself, friend or not. Live in the moment. Try just enjoying and being in the moments rather than capturing them through the screen of your phone. Life isn't meant to be lived through a screen, nor is it about getting the perfect photo. Enjoy the bloody moment, people. Stop trying to capture it for everyone else. Tell your loved ones you love them every time you get the chance, and love them with everything you have. Please cuddle your dog. I will miss that. Talk to your friends. Put down your phone. Are they doing okay? Travel if it's your desire. Don't if it's not. Work to live. Don't live to work. Seriously, do what makes your heart feel happy. Eat the cake, zero guilt, and say no to things you really don't want to do. Give the gift of life. Oh, and one last thing if you can. Do a really good deed for humanity and myself and start regularly donating blood. It will make you feel good with the added bonus of saving lives. I feel like it is something that is so overlooked considering every donation can save 3 lives. That is a massive impact each person can have, and the process is really so simple. Blood donation, more bags than I could keep up with counting, helped keep me alive for an extra year. A year I will be forever grateful that I got to spend it here on earth with my family, friends, and dog. A year I had some of the greatest times of my life. Till we meet again, Hall. Holly left this world on January 4th, 2018, and wrote the above words for her family, asking them to post it after her death. This was Holly's form of spiritual care. It was a way in which she linked the relationships that meant most to her in life. It was a legacy that she left behind. It was her moral and social analysis on what mattered most in life. It was a way of reflecting upon the importance of what she had learned. So let's now look at how we understand the complexity of patients' spiritual pain. The large body of empirical evidence that is out there suggests that patients' spiritual and existential experiences can influence disease processes, and they raise the need for all of us as healthcare professionals to understand the complexity of patients' spiritual pain and distress. Spiritual care is an intrinsic and essential component of palliative care and recognized by and included in the World Health Organization's definition of palliative care for almost 15 years. There is growing evidence that spiritual care at the end of life is important to patients and that patients want healthcare professionals to provide this type of care. The positive effects of spiritual care on a patient's quality of life have been reported in literature across age groups and patients' medical conditions, including cancer, organ failure, and dementia. There is also evidence that lack of spiritual support by healthcare teams is associated with poor quality of life, dissatisfaction with care, less hospice utilization, more aggressive treatment, and increased costs, particularly among ethnic minority groups and patients with high levels of religious coping. And despite this emerging evidence and its status as a core dimension of palliative care, spiritual care remains the least developed and the most neglected dimension of palliative care. Let's also look at spiritual care in the context of cultural safety. We know that when we're working with patients, it's important that we honor their beliefs, their values, their traditions, and their practices. We know that we need to be aware that association with particular cultural, ethnic, or religious groups can influence expression and meaning of pain and suffering, attitudes towards disclosure and awareness of illness, beliefs about the cause and the meaning of illness, a person's choice of healer and treatment regime, attitudes towards death and dying in general, beliefs about the afterlife and the value of human life in the body, expressions of loss and grief, death rituals, including preparation for burial, funeral practices, or memorial services, and customs for disposing of the body and mourning rites. Beliefs about death, dying, and emotional responses to end of life are influenced by culture. When in the course of illness, individuals are prepared to accept palliative care may also be influenced by culture. It's important to be aware of your limits and your cultural competencies as a caregiver, to know how your own culture has influenced your beliefs and values prior to assessment of patients. Let's look at the example of pain management and sedation in palliative care in the framework of cultural safety. Knowing how individuals within a culture perceive pain and suffering can help caregivers understand pain behavior and requests for medication. Some studies have indicated that the more different the culture of the caregiver and the patient are, the more unlikely it is that accurate pain assessment and subsequent pain management will be achieved. Palliative caregivers should be aware that some patients might choose to deal stoically with pain. Suffering may be endured, particularly if there is cultural support for it. Stoicism may be viewed culturally as strength or endurance. Patients have the right to be as pain-free as possible. However, some patients may choose a certain amount of pain. Some members of certain religious groups may be influenced by a belief and a mandate that they must meet God in a pure state free of drugs. Be aware that cultural and religious beliefs can impact issues in palliative care around feeding, hydration, and resuscitation. When there are language barriers, an interpreter should be arranged for, particularly when significant information is being shared. If possible, unless there are extreme circumstances, such as a pain crisis or advanced directives are not known in an imminent life-threatening situation, the interpreter should not be a member of the family. There are barriers in providing spiritual care and palliative care. Some of these are institutional. Caregivers are tending to high numbers of patients with fast turnover, high workload, low staffing ratios, and underfunding. All of these can contribute to poor spiritual care. Another barrier can be a personal barrier. Spiritual care can be personally challenging with an emotional cost, sometimes resulting in compassion fatigue for caregivers. Another barrier is education and training. Formal spiritual care training and education is rare. Spirituality can be affected by culture, history, social background, and one's own beliefs, and it's important not to judge. Some feel spiritual care is easier when the healthcare giver and patient share the same beliefs. But the literature shows that sometimes spirituality is best expressed when there's not a common religion, as it involves some sharing of common humanity. However, be careful because social, religious, or cultural discordance, inappropriateness, or proselytization can create difficulties or an atmosphere of mistrust. Let's look at some questions about palliative care in Canada. What does palliative care have to offer? Isn't it just about pain control? In Canada, palliative care offers a wide variety of support. It is meant to consider the fears and stresses of the patient and their families. It is meant to closely monitor physical symptoms such as pain, nausea, loss of appetite, and confusion. It is also meant to ensure that care is respectful and supportive of patient dignity, that it considers the emotional and spiritual concerns of patients and families, that it respects the social and cultural needs of those patients and families, and that it uses a team approach that may include volunteers, social workers, spiritual leaders, in addition to medical staff. If ethics are culturally dependent, How then do we approach issues of ethics in situations where the values and ethics that we hold may not be similar to the cultures of our patients or our family members that we come in contact with? Do we simply dismiss the ethical and religious concerns of others? Or do we hold that our ethics and our beliefs are somehow of a higher order? Clearly not in either instance, but these are complex issues and questions. And it is also clear that as healthcare providers, we cannot abandon the professional ethics we have or disregard the laws which govern us. I'd like to leave you with one final thought. We share common needs for respect, a common need for being valued, and a common need for finding meaning at the end of our lives. This is spiritual care. Our challenge is to find our common ground, to be aware of our differences between ourselves as caregivers and those of our patients and our families, to honor them, and to create environments in which diversity is both welcomed and valued.